Well, welcome to the Practice Growth Podcast.
It's such a pleasure to have you today.
Yeah, it's great to be here. I'm excited about this.
And you are the new APTA president. I guess not so new anymore. You've been here for about a year or so.
Exactly.
As well as the associate professor at Duke, which you were alumni of, so very exciting. Going to hear a lot about your story and what has been going on with the APTA. We've got lots of questions, so just an honor to have you on our show.
I appreciate the opportunity. It's fun to have these conversations, and it's exciting to get to talk about some of this stuff.
Tell me a little bit about your background, going from a clinician to an educator to becoming the APTA president. What made you want to do that, and what were your motivations that led you there?
I grew up in North Carolina, practiced in North Carolina after graduating from Duke. Always worked in sort of hospital-based settings, inpatient, outpatient, primarily neurologically impaired patients. But somewhere early in my career, also got involved in the American Physical Therapy Association, kind of fell into sort of legislative advocacy early in my career, accidentally went to a meeting where I had the opportunity to go to Capitol Hill. And realized I really enjoyed that kind of aspect of the career. I didn't know much about it as a student, and got involved that way early on. Sort of found that I enjoyed those conversations, figuring out how we could sort of move practice and the profession forward, and then had great mentors that sort of kept moving me into different roles, both within APTA and sort of career development. Clinically became a neurologic certified specialist, did a bunch of different things in different sort of patient populations, and then professionally sort of went the academic route. For a big portion of the early years in faculty at Duke, I was a director of clinical education, which was a great blend for me because I sort of always loved thinking about how we teach all of the roles of what we do in clinical practice, and then moved up into other sort of administrative and leadership roles at Duke. And on the APTA side, did a lot of different things over the years. Ultimately sort of became chapter president in North Carolina during a lot of sort of legal and legislative battles that we were facing relative to practice. So that was great to get to use sort of that advocacy background and interest I had in that role to help the state of North Carolina. And simultaneously was sort of always involved at APTA in the House of Delegates, and ran about 6 years ago for vice speaker, which is one of the positions that helps run the House of Delegates, but also has a big role in the work of the board of directors. And then fast forward about 5.5 years later, and last year about this time decided to, or did run for APTA president. The elections were about a year ago, and took office January 1st.
So it's not easy being the APTA president. I'm sure there are a lot of different challenges that arise. Would love to know from your perspective, what were the different challenges that you saw you wanted to address in the industry and make an impact right away with?
Yeah, I served on the board of directors for about 5.5 years, so I was really involved at the national level in conversations about where we were making progress, where we needed to make more progress, where our opportunities were for change. And then as I looked towards, running for president and becoming president, some of the things I think that were front of mind were just, I really feel like we're at a point in the history of our profession and association that's really an inflection point, right? We've had over 100-year history, built our practice, built our autonomy as a profession over that 100 years. On the association side specifically, that's 100 years of being a very stable organization. History of professional associations and healthcare associations especially are to be that stable force for the profession that everybody goes to for their information. Well, the world's changed dramatically in the last few years, and as PT has grown and exploded and our practice has expanded, the expectations of associations have changed dramatically as well. And now you can get information and resources and networks in a lot of places. And so I really thought a lot about that and what do we need to be as a profession and also as an association at this sort of change point in history, because so much is changing. Information's coming at us so rapidly. And I really wanted to sort of focus us on what is that next version of our evolution as a profession and as an association. I also, like you mentioned at the beginning, I spend my day job with students, which I love. We have awesome students, and I get to be in the class and in the hallways and in the building with them all the time. I stay in close contact with our alumni and our recent grads. So I'm hearing their thoughts in a very different way than sometimes I was hearing what experienced members of the profession, clinicians, association, practice leaders we're talking about, and how can I bridge that gap between what the expectations and aspirations of our newest professionals and what the history and experience is of our people that have been involved for a long time. And so that was really front of mind. We have challenges, of course, right now with payment, with cost of education, with administrative burden. Those three are the sort of the big three that are keeping me up at night, literally, sometimes. And so how can we make sure that the next generation of therapists that I'm seeing every day in the classroom are going to have all of the resources and opportunities that I had when I finished PT school?
Yeah, it's really great. You have that perspective. You've got those students that are hungry and coming out. You've got all the university faculty, and of course, you said you were a DCE, so you connected with clinics every day.
Yeah, and I'm a residency director now too, so I'm involved with sort of that aspect of education and practice. So I really hear a lot of different perspectives, and sometimes they weren't all matching up. And I wanted to try to get those all synced up as president.
Yeah. So with all of that, and you mentioned a few obstacles and challenges that you first saw that you wanted to come in and change, what would you say you've done so far that you've been really proud of or excited to share?
Yeah, I mean, it's been a exciting and at times crazy year. We've had so much change in the federal government with reform and regulation, and that's given us some challenges, but it's given us some opportunities as well. The board of directors has been working a lot this year on prepping the organization for our next strategic plan, which officially begins on January 1st. So we can talk about that a little bit too. But one of the things this year that I've been really focused on as we sort of lead up to that new strategic plan is how do we begin to communicate about the organization and about the profession differently? When I came into office, another thing that was really on my mind a lot was the really, quite frankly, the extreme negativity on social media within our profession, not about our profession. There was actually a lot of positive media about physical therapy, but we've seen some negative media within. And a lot of it's founded, right? There's a lot of frustration right now about those issues around payment, administrative burden. And so how do we take that frustration and address it and communicate about what we're doing as an organization and then begin to put the things in place to address change? And so that's where I've been focused this year. And I'm excited as we move into the second year of my presidency, we really get to launch those plans as we begin this new strategic plan.
Yeah, and I'd love to hear more about the strategic plan and what you guys, I know you said January 1st, which is January 1st, 2026, is just in case when this airs. Would love to hear more about what is involved in that and what you guys have said.
Yeah, I mean, I think for most people, strategic plans aren't exciting. But for an association or a big organization like the APTA, they really truly drive the work of the organization. They drive the budgets, they drive the staff plans, they drive the staff organization, they drive the whole work of the board of directors, and also the interests and the influence of in the APTA sphere, our components like our chapters, our sections and academies like private practice, that we all want to work alongside us with that strategic plan. So as we move into 2026, the big priorities of that strategic plan, first and foremost at the top of the list is advancing payment. That's work APTA has always been involved in, but we're putting a lot more effort, a lot more resources into really taking major steps into advancing payment for our profession, making sure we're giving what we deserve. Within that, decreasing administrative burden and inefficiencies within what we're expected to do by payers. And so we're really putting a lot more effort in that area, and you'll see things start to roll out in 2026 more around how we can affect change, work with different coalitions and partner organizations to try some new strategies and evolve the way we've been thinking about advocating for payment. The second one is around empowering our members. So APTA is a large organization. There are lots of ways to engage and be involved in an organization as large as this is. For some people, that's the advocacy route. That's how I got involved. Some people gravitate to their state chapters. Other people gravitate toward the specialty sections and academies. Other people find other ways to volunteer and be involved through education or conferences. So it's a really big organization, and there's a lot of different interests. So we really want to focus more on how can we empower members to find their people, feel that sense of belonging that they need to have to engage and reap the benefits of an organization like APTA. And also, how can we invest back in those members and make sure they have the resources that they need to sustain the pressures of practice. And then the third is in advancing practice. Also work APTA has always done, but putting different and more resources in there as well. As I mentioned at the beginning, we're really seeing rapid change in a lot of areas of practice. I think we'll talk about some more as we chat. But how can we be on the forefront of those advancements? How can we drive those advancements instead of be a passenger as the world drives those advancements? And then how can we prep our members to be ready to lead those advancements in their clinical practices, in their businesses, and in their facilities that they work in every day?
That's really refreshing to hear, especially the advancing payment. As you said, it's always been something that you guys have worked on, but putting it at the forefront and making it a priority.
Absolutely.
I know we hear all the time that's one of the biggest issues and struggles. Would love to hear a little bit more, like you said, about advancing practice and innovation and what you guys, how the APTA sees innovation, how you personally see it. I know you actually are the director of education innovation at Duke. So would love to hear more about what you're doing towards that.
Yeah, it's funny because my title at work is Director of Educational Innovation. I was really afraid of that title when I took that job, and I actually begged for that word not to be in my title. I think that is a word that carries a lot of weight and a lot of expectation, but it's hard to define. Like, what is innovation? And sometimes innovation is very simple. Sometimes innovation is just doing a little thing differently that can make a big impact. But I think sometimes the expectation is innovation is this big thing that nobody's ever thought of. And sometimes it is, right? So I think at APTA, we're looking at that spectrum of innovation. What are the little simple things that we haven't been doing that we can do to make a change in practice? What are the things that maybe aren't so simple, but we've been talking about a long time, and we just need to turn a dial in a different direction to make change in practice? And then what are those big things that we haven't had at our disposal before, or that we haven't done? I mean, we're all seeing in our daily lives AI and the infusing sort of tech and digital is everywhere. And that's going to be the case at APTA. You know, APTA has put a lot of resources over the last couple of years in digital tools for our members. And there's a digital resource library where our members can go and get vetted lists of the things that can augment or assist them in practice, both from their interface with patients, but also in their documentation, decreasing administrative burden, those types of things. So we're really wanting to put those, to put those in places that are easy to access by our members, and our members be able to trust that these are the things that are going to help them because they've been vetted by APTA. I think it's hard to predict what will be different in practice. I mean, I graduated 20 years ago from PT school, or I guess more than that now. And, there were just aspects of clinical practice that were new. Women's and pelvic health was just being talked about. I'm not even sure if we really had a lot of conversations about PT's role in oncology, those types of things. Now, those are two of the fastest growing areas of practice a couple of decades later. So I think a lot of times about what are those things now that our students and our new professionals are barely hearing about, but are going to dramatically change over the course of the first decade of their career. And I think we're seeing the sort of emergence of PTs with a bigger role in primary care. We're seeing PTs with a bigger role in emergency care practice. So those frontline sort of roles for physical therapy that are finally coming into clear focus are really exciting, and APTA is putting a lot of resources there as well.
Well, it's great to see you guys as the forefront on innovation and embracing it, because I do think historically the physical therapy industry doesn't love to change, and it's hard to sometimes embrace some of those changes that are coming. So love to see that you guys are really putting that as a priority and highlighting it and embracing and pushing it.
Yeah, and a big sort of word I've been using a lot in my work with the board and other leaders is how can we focus less on change and focus more on evolution, right? Because we've done such good things over the first century of our profession that have built that foundation that we need to evolve and take off into the next profession. Change is scary, and definitely sometimes things do need to change, but really I think we just need to embrace that evolution and where are we headed next, built on the solid foundation that we've had.
Yeah, and at Prompt, we really believe in innovation. It's the why to the innovation, and the why is, well, we've got these admin pressures, we've got burnout, we've got people leaving the industry, and how can we make it easier for them and use that change and those different AI tools to be able to keep them loving their jobs and succeeding.
Absolutely, right? It's coming, or it's not even coming, it's here. And so how can we integrate it in what we're doing? Let it help our practice be even more effective and more efficient. And also, how can we use it to tell our story better? How can we use it in our advocacy to get better reimbursement and payment? There's lots of ways that I think that technology is going to rapidly change how we practice. And so that's all embedded in that strategic framework priority under advancing practice as well.
And you also mentioned that the industry is looking more at primary care providers and those alternative practice models, or just evolution of practice models. So tell me more about that, because I love to see it going in that direction.
Yeah, it's sort of hard to believe, but as a profession, we just got direct access in some form in 50 states last year, or 2024. So, that took a long time, obviously. And now we're already seeing rapid change in a move toward designating PT as primary care providers. So we've been fighting for autonomous practice for decades, direct access for decades. Now that shift into also more recognition as a primary care provider is being built on that advocacy success that we've had in autonomous and direct access sort of wins. We just saw this year the state of Utah get designated as primary care providers. We saw the state of Montana get designated with physician status. And at first, people didn't really know, what is that going to mean? What's that going to look like? I think we're on the forefront of recognizing the benefits that are going to snowball from that, right? But to be on that level playing field with other primary care designation providers is going to be huge. I mean, I just was in a meeting recently and heard from a private practice owner in Montana about how now they are going to be able to have immediate access for workers' comp patients to come directly to physical therapy, not have to bypass a more convoluted system. So that's one immediate win that we're seeing from some of these things happening. And as we see one or two states begin to have this win, we know from our history that that's just going to snowball. And we've had more state-based legislative wins in the past 2 years than we've had in our history. So I think we're going to see more of those sort of primary care type wins as well. Also this summer at the APTA House of Delegates, approved the final step in pursuing primary care as a specialty certification designation. So ABPTS, the American Board of Physical Therapy Specialties, will be putting forth a specialty certification exam in the coming year so that people can have that specialty designation under primary care as well. We also have plans underway to build more residency and fellowship education in that space as well.
Oh, it's fantastic. And I think being able to see this shift with the primary care providers really should hopefully help reimbursement as well and value-based care. So we'd love to know how you guys are utilizing all of that together to your first priority, increase the reimbursement.
Yeah, absolutely. I mean, we've always had PTs practicing in that direct access or as primary care providers. There's PTs that have fought those battles and provided that service for a long time. So it's not new in a lot of places, but now we're getting more recognition from it, which is exciting. So, I think a good example is a couple of years ago, where APTA in 2024 put out the Value of PT report, which is a really comprehensively done sort of actuarial report on where are areas of practice that we can save money if you go directly to your physical therapist. We're now being able to use that for big advocacy wins in state houses, federal government, regulatory, and also insurance companies that are beginning to see changes in dropping authorization requirements, increasing reimbursement. Now, those wins aren't happening as fast as any of us want to, for sure, but we're seeing some tides turn in those areas that are really exciting. So I think on that sort of primary care conversation, we have the growing sets of data to be able to advocate that more and more physical therapists should have that primary care role. Our programs, our educational programs, have been doing education in this space for a while. They're ramping that up as well. And so, we're really on that precipice, and I think it's a good example, going back to something I said earlier about what's that next evolution of practice. We're at that inflection point, and I think this is something we're going to see really grow in the next decade.
Yeah. Wow. I love to see all the state wins. Are you guys using that to share with other states and
Absolutely.
then kind of use it as a model to keep going?
Yeah, we've known over our history that when one state wins something, then it's easier for the next state to win. When two win, it's easier for 4 and 6, and then there's a snowball effect. APTA, in partnership with APTA Private Practice and APTA Orthopedics, academies last year launched Spark, which is the State Payment and Advocacy Resource Center. So it's now a comprehensive sort of clearinghouse for when one state has a win, they can put their resources, their activity, their actions in one place, and other states can more quickly replicate it. So we're seeing that already have huge wins, and that's one of the reasons that we're seeing faster wins in state houses in 2024 and 2025. That we're communicating better, we're communicating quicker, and that's been great work by private practice and orthopedics along with APTA that's sort of putting the systems in place to drive that advocacy efficiency, and we're seeing the wins from that now.
And the more people we get involved in doing
Absolutely.
the advocacy at the state level, at the private practice level, all the way through the hospital level, the better we'll be together. So I know that's just a call to action on my part all the time. I'm always encouraging people, instead of complaining, to get involved.
Absolutely. Yeah. I mean, that's where we get the wins, is more clinicians and patients and business owners telling their story to their local and insurance and federal representatives, right? These people aren't physical therapists. Most of them haven't been a patient. They don't understand everything that we do and what the pressures we face are. So we need more and more people telling that story and telling a cohesive story. And that's something else I've been working on in my first year as president, is how can we work with other organizations, coalitions of other professions, but also other like-minded groups within the physical therapy sphere to say, let's there's this problem. Let's go at it cohesively and collaboratively, and then we'll have more success.
What can you tell people, listeners, on how they can help get involved or how they can make a change themselves? Yeah,
I mean, there's so many ways. APTA has long had a really successful grassroots network. So going to the APTA Advocacy Action Center, which is a mouthful, has tons of resources that you can use to directly lobby your federal representatives, senators, and members of Congress. Templated letters on all the activity that APTA has going on in Congress right now. There's a number of bills at any given time. Those are always bipartisanly sponsored. That's another thing that people don't sometimes understand, or is a misconception. When we enter into activity on the Hill, we almost always do that with a Republican and a Democrat co-sponsor. It's really important for us to have that bipartisan support. Our issues are bipartisan issues. They're about helping patients. That's not a Republican or a Democrat thing. That's what we do, and it's core to who we are. So whatever your political affiliations are, I also want people to know that there's a place for that voice within APTA, and there's a resources for that. It's a time right now that I think our politics are divisive, but what we do for our patients in an advocacy arena isn't and doesn't need to be. And so the Action Center has tons of resources. You can sign up to get alerts so you know what's going on. It's also important to get plugged in with what's happening in your state. So every state chapter is really active in their state houses and their state legislatures. And also the state chapters tend to also be active in sort of the state-based intermediaries of insurance companies. Like I know in my home state, we have a great relationship with Blue Cross Blue Shield in North Carolina. So finding out those resources within your state to plug into the people that are already doing that work and say, hey, like I'm a practice owner, or I'm a frontline clinician. I want to speak to people that can help make a change. Your state leaders in APTA are going to be able to connect you with those people, and also our grassroots network at APTA National is going to be able to help you connect with those people.
Yeah, and I heard that you can get a meeting with CMS anytime. You can actually request one, and they have to take one with you. I actually just did it the other day.
Yeah, that's awesome.
So you can be reaching out and really bringing any of your own information, your own outcomes to them to really help.
Yeah, and I think two other things that I think people don't do enough that are really impactful is going to Capitol Hill is great, but it's really a lot of the times those representatives of Congress or senators, they want to see what's happening in their own district. So call their local office, invite them to your practice. I've been able to be a part of that multiple times where I work in the Duke Health system to invite legislators into our clinics, see what's happening, see the pressures you face. They really enjoy that opportunity. They learn so much by doing that, and then they become better advocates of you. So do that. APTA can also help support you if you want to do a clinical visit in your local area. It has a huge impact. And the other thing that I think we underestimate from an advocacy standpoint is physical therapist assistants spend so much time with their patients, probably more so than any other healthcare provider. and you hear your patient's frustrations, their frustration with having to cancel visits because they're not authorized, or the delay in a prior authorization. So help them know how to call their insurance company. APTA's got resources for patients as well, point them in that direction. I have a friend that has a computer in their front office, and when patients want to have a voice, they take them to that computer and say, here's your resources, here's some from APTA, here's how you also can contact Medicare, CMS, your insurance company, your legislator about these issues.
Yeah, and you actually guys just did a survey recently about the perception of physical therapy, and it was great. The patients love us. They really do. It was, you can tell a little bit more about the results, but it sounds like it was super successful. That's not the problem. The patients are really
correct.
All for it.
Last year we did a physician's perception report. This year we did a large-scale population patient perception report. Both were very clear. The physicians and the patients love us, respect us, and recognize that we have an important role to play in their health and in their rehab and in prevention. Where the disconnect is they're not sure how to get to us. So we've got a lot more work to do. APTA is going to be doing this as well, and I invite everybody. It's really, from that data, shows us it's about helping them have the access to us, helping them understand that referral and authorization process that we all hate and is so onerous. It's getting those burdens down so that they can get to us. It's not because they don't want to come. It's not because they don't know that we can help. It's because the systems and the ability to navigate, both for physicians and for patients, to access our services is where the breakdown's happening.
So maybe next year we could do a payer perception survey.
Yeah, that'd be great.
And you can let us know how that goes too. Great. With all of that, it sounds like the APTA really is starting to do a lot more. Well, they've always done a lot, but really, again, prioritizing what they've heard from their members at the top now. So would love to know, because this question comes up all the time, why should somebody be an APTA member?
Yeah, APTA is the largest advocacy organization for physical therapy in the country. APTA is working harder than most people would understand or believe on all of these issues. I am determined as president to lead an organization that's not only working on these issues, but is fighting for our members on these issues. And I think we can fight harder when we have more people at the table to join in that fight. And that's one reason to belong. We need that help. We need that support. We need those various perspectives and opinions at the table and involved and engaged so that we can take those evolutionary steps forward in getting better payment, getting decreased burden, getting better resources for our new grads that are burdened by the cost of their education. We want to take those steps forward in a fight, and we know we can do it better with more people involved. The other reason to belong is all of the resources, activity, the networking that has really been instrumental in my career. Obviously, I've done a lot in APTA, and I've gotten to the point that I'm president. But even without any of that, my experience in the organization that's been instrumental for my career development is being able to connect with people that I wouldn't intersect in my daily job. That have been transformative and helpful in my career development as well. The education that we provide, the resources that we provide are all great, but it's really that ability to connect, belong within a group that I can find ways to develop my career, but then also join a fight on all the things that we know we need to improve. And that's why we need everybody at the table.
My previous role was a VP of clinical excellence at a very, very large enterprise organization. And we built into the career ladder at the highest rung, right? Because you should always have a mentor and you should always be mentoring someone at the highest rung, encouraging them to find a leadership role or a position within the APTA, because we feel like that was also more people to mentor them outside of the organization.
Yeah, absolutely. We're all products of the great mentors that we had. And I would be nowhere and not in this role if it hadn't been for the great mentors. And most of mine were through APTA, and through those connections. It's really changed my career. But you're right. I think that ability to sort of engage is different. So when a lot of people are like, why should I be a member? My answer to that question is, not only should you be a member, but you should be a member who's involved and engaged. And that's when you'll feel the value of the membership.
Yeah, that's a great point. That's when you're going to feel the value. You'll be giving and getting back just the same you give.
Absolutely, yeah. And there's a role for everybody, right? There's a way to get involved. Sometimes it's hard to find the role for you, and I think that's a problem that we have. And that's sort of in the next strategic framework under that empowering our members aspect is how can we make it easier for people to find that way that's meaningful, that makes it clear why there's a return on the investment for that. I think that's where the gap has been sometimes. It's similar to the conversation about our patients know that we're doing good things, but they don't know how to get to us. I think APTA's got that challenge as well. People might recognize that APTA is the advocacy group and has the networking and has the clinical practice guidelines and has specialty certification and all of that. But finding that way to plug in is what we want to make even easier.
Yeah. Wow. I think that's a good something to work on for the upcoming year. And in addition to that, so there's some other organizations popping up too. I know APTQI and a couple others. How are you guys all working together, and what does that look like?
Yeah, I mean, that's a great example from just my first year in practice. I've worked closely with the leadership of APTQI, APTA Private Practice. We're working on some collaborative things now around some efforts in advancing practice and reducing administrative burden. We meet regularly and say, all right, we all know that this is a problem. How can we go after solving this problem in new and different ways? We have a meeting here tomorrow about that. And also, what's our different unique roles within that? Like, let's not trip over each other. Let's facilitate forward movement amongst each other. And so that's how I'm looking at it in my leadership as president. I've been fortunate to have great progress and great work with APTQI and APTA Private Practice this year, and I think you'll be hearing more coming out of that work in 2026.
Great, we do a lot more together, so I love that approach. And for us as a technology company, what would you recommend that we could do better to help with the industry to bring people together, or what are we doing well that you feel is impactful?
Yeah, I mean, I was fortunate to get to tour Prompt headquarters a few weeks ago. That was a lot of fun and exciting, and get to learn more myself. I think as companies like Prompt and also, anybody involved in that tech space, I think what's so great is recognizing that companies like you all that recognize that there's a core hands-on personal connection to what we do that can't go away. But how can we use technology to make it easier for us to do the things that are core to what we do as physical therapists? And so I think for anybody in that tech and innovation space that can recognize what's unique about PT in our practice and accentuate that through technology and evolution and advancement and innovation, that's just awesome. And that's what we're going to need more and more of.
Yeah, not to replace it, to augment it, accentuate it, and help people do what they love, which is treating patients and getting them better.
Absolutely.
Awesome. Well, any last minute words of advice for anyone listening today, or encouragement that you want to tell our listeners?
A message I always like to try to give is, and we touched on it a little bit, right? APTA is fighting on these issues. I know, and it literally has kept me up at night sometimes this year of how challenging things are for most of the people within the profession right now. And I just want people to hear that we're fighting hard on that. A lot of people are fighting hard on that. A lot of leaders across the organization, within APTA, across partner organizations, recognize those challenges and are fighting hard on them. None of them are easy, and all of them are challenges embedded in an infinite number of places. And we live in an Amazon Prime culture where we're used to quick fixes, and unfortunately, these are hard issues that are going to be marathon sort of sprints. But we're gaining speed, we're gaining traction, and really at a unique point right now where we're seeing some things turn and change fast. But we need people on board to sort of push that even harder. And so the message is, we hear you, we're fighting. We're going to fight even harder in 2026, and I'm sure we'll fight even harder than that in 2027. And we just want everybody partnered with us in that fight.
Well, I look forward to the strategic plan coming out with the prioritization, like you said, those big ticket items that we all care about, which is the reimbursement, the innovation, and the practice models, and encourage everyone to really think about that and adopt it and embrace it themselves, and then help be part of it.
Absolutely.
Awesome. Well, This was such a pleasure. Thank you so much. I know
you.
your time is so valuable, so thank you for
This is
spending
fun.
it with
This
us.
is the fun stuff.
All right, thank you.